Volcano, a leader in intravascular imaging and assessment, will help you realize the power of Volcano in everyday clinical practice. This interactive tutorial will help demonstrate how you can take advantage of fast, easy-to-use Ivus and FFR to deliver clarity in your approach, confidence in your result, and convenience in your lab as part of your standard clinical workflow. When diagnosing complex cardiovascular disease, it is important to understand both the progression of atherosclerosis as well as the limitations of 2D imaging modalities. Volcano Ivus is designed to provide added clarity to the overall disease state and define a more complete diagnosis of each individual patient. For years, physicians have searched for fast and simple tools to visualize a more complete picture of the state of atherosclerotic disease in their patient. Physicians have depended on the convenience and availability of angiography for decades to provide important information on this complex disease state. Although angiography is effective in providing a spatial roadmap of vessels, it delivers an incomplete picture of the diseased tissue itself. This is because angiography provides only a 2D projection of the lumen and offers no information about the disease present inside the vessel wall. It is important to note that angiography only highlights where blood is flowing and thus where the lumen has narrowed. It cannot measure the volume of disease that has accumulated in the vessel wall, the extent of remodeling the vessel has endured to accommodate this plaque, or the type and stage of disease that is present throughout the vessel. Multiple views and contrast injections do little to provide added clarity to the diagnosis. Atherosclerotic disease progresses faster in some patients than others. In many cases, disease progression takes place through the repetition of plaque rupture, followed by vessel healing. A common treatment for these severe blockages is to place a stent, a tiny mesh tube designed to hold open the narrowed vessel and restore blood flow. Some of these stents are coated with drugs that are eluted over time and help reduce the buildup of scar tissue around the implant. Because angiography does not visualize the lesion itself, only the lumen, it is possible to select an incorrect stent length and diameter. A study has shown that using angiography alone to guide drug-eluting stent implantation leads to improper placement 67% of the time. Volcano Ivus provides clarity in your approach, allowing you to visualize the total vessel, not just the lumen. Ivus provides information that angiography alone cannot deliver. Because of these inherent limitations of 2D angiography, physicians have looked to Ivus to provide more detailed images and measurements to confirm proper stent placement. Proper stent sizing and placement is essential to long-term outcomes. Volcano is committed to patient care and providing physicians with the necessary tools to optimize treatment regimes. Finally, utilization of Volcano Ivus provides information that gives you confidence in your results.